Proudly supported by Pacific Office Automation, copy, print, workflow, and IT. Problem solved.
And then if there's a prescription needs to be written, then we can do that.
They look like tiny little blisters almost.
For Jennifer Herman, the health concern happened, as it so often does, over a weekend. A mysterious rash on her youngest son Aiden's face.
We were sitting right here and he was sleeping on my lap. And I started Googling, small blisters, and that was very scary.
It was something the mother of 4 hadn't seen before, and she was dreading having to pack up all her kids and head to urgent care to get Aiden checked out. Fortunately, she didn't have to.
So I logged in and put a request in for an appointment, and within 5 minutes had a call back from a physician.
Jennifer was able to have a doctor see Aiden over the phone via FaceTime through the UW Medicine virtual clinic, which is available to anyone in Washington State.
So does anybody in the household have any symptoms?
It's something that I think is just invaluable. So convenient, great service.
And you just want to get better quicker, right? I mean, you feel miserable and you want to get better faster. So this is a great convenience for many patients.
Dr. John Scott, who oversees the UW Medicine's telemedicine program, says the virtual clinics are a hit with both patients and healthcare providers.
This is being very well received by patients here in the Northwest.
They're happy that they're providing a service that can save the patient a trip to the emergency room or urgent care. So, it's really helping the patients, and so we're happy to be able to help our patients.
He says the virtual clinics are meant to address non-emergency health needs like coughs and sinus infections and headaches, or, like with Aiden, a mysterious rash, which fortunately turned out to be nothing serious.
I think it's totally safe to just monitor him and see what happens.
Each virtual visit costs $40. On-call doctors and nurse practitioners can evaluate patients and write prescriptions through video calls via FaceTime or Skype, or just an old-fashioned phone call if the patient prefers, any time of day or night, every day of the year. Dr. Scott says more than 150 patients a month schedule a virtual house call through UW Medicine, and that number is expected to grow quickly.
I think it is the way of the future. So our former head of Medicare, Don Berwick, thinks that by 2017, about 70% of all of our outpatient visits will be done this way.
For patients like the Hermans, that wave of the future is already part of their everyday life.
Do you have any questions for me before we sign off here?
Jennifer says the virtual clinics have transformed her family's health care by allowing them to address their health concerns faster, more conveniently, and less expensively, keeping everyone in this home happier and healthier.
Just incredible peace of mind that it's great doctors providing great care, and I feel really lucky to have it. Thank you.
You're very welcome.